To start off, I want to introduce my topic, which is breast cancer. Breast cancer is a disease in which cells in the breast grow out of control. With that being said, the different kinds of possible breast cancers depend on which cells in the breast turn into cancer. Breast cancer is the most common cancer in women and also can be seen in men, transgenders, and non-binaries as long as they have breast tissue. However, breast cancer is most often seen in women. I decided to write about breast cancer because even though we didn't directly talk about it in class, I felt that it has so heavily impacted females that it is worthwhile to talk about for my final project. Throughout the video, I am going to discuss the different types of breast cancer, the treatment for breast cancer, how it is currently affecting people all over the world, and also I'm going to tie it into intersectionality. While there are many different types of breast cancer, I'm going to focus on the more common ones. The most common types of breast cancer are invasive ductal carcinoma and invasive lobular carcinoma. Invasive ductal carcinoma is when cancer cells grow into different parts of the breast tissue. These cells can then spread to other parts of the body, which is really dangerous. The other type, invasive lobular carcinoma, is when cancer cells spread from the lobules to breast tissues that are close by. These cancer cells can spread to other parts of the body as well. Invasive ductal carcinoma accounts for about 80% of invasive breast cancers, while invasive lobular carcinoma only accounts for about 10% of all invasive breast cancers. Additionally, invasive lobular carcinoma is mostly seen in women in their mid-60s, whereas invasive ductal carcinoma is seen in women in their early 50s. In order to treat breast cancer, it is imperative that doctors find out what type of breast cancer you have. For invasive lobular breast cancer, there are 4 ways of diagnosing it: a mammogram, ultrasound, MRI, and a biopsy. The doctor must then determine the severity of your breast cancer, and the treatment is based on that. These different treatments can range from surgery to hormone therapy to radiation to chemotherapy. Surgery can be done to remove the cancer and a small portion of the healthy tissue in the breast, or to remove all of the breast tissue. Hormonal therapy is mostly used to prevent the cancer from recurring and also to shrink and control it. Most lobular carcinomas use hormones to grow, so using hormonal therapy helps stop this growth. Radiation and chemotherapy both use high-tech machines to kill off cancer cells. Chemotherapy is very popular amongst many different types of cancers. The treatment for invasive ductal carcinoma includes the same techniques, and it really depends on the severity of your cancer. One of the main reasons I chose to talk about this topic is the vast effect it has had on females around the world. From statistics, about 43,000 women will die from breast cancer. Throughout the semester, we have heavily focused on race and gender and defining both of those terms. Race being grouping people together based on shared physical and social qualities, while gender is considered with references to social and cultural differences rather than biological differences. Using these themes, race and gender, I wanted to look more into the racial disparity of breast cancer and why, more specifically, African American women are more at a risk of getting it. Audre Lorde, one of the writers we learned about, actually fought breast cancer for 14 years and was scolded for acting as a breast cancer patient. Lorde was amazed at how African Americans were at a greater risk of contracting breast cancer and had way fewer resources when dealing with the cancer compared to whites. This connects to the idea of intersectionality because Lorde was categorized as both African American and fighting breast cancer, which made things harder for her. An article I found backed these ideas up by saying Black women are more likely to be diagnosed with triple-negative breast cancer, more likely to be diagnosed with later stage disease than other women, and they have the lowest survival rates in each stage of diagnosis. This led me to think, why is this, and why are minorities at more of a risk of lesser care? Because this is the same case with the COVID-19 outbreak as well. The disparity in treatment for people of color is unfair, and it shows that all women, no matter their age, ethnicity, or economic status, should be allowed the best breast cancer care. Also, regular breast cancer screening should be available because it would allow doctors to stop breast cancer at the early stages and allow patients the best survival chances. As we saw when talking about intersectionality, combining being female with other factors can make things hard, and in this case, female African Americans are hit hard by breast cancer. An NGO I found that supports breast cancer awareness is the American Breast Cancer Foundation. The goal of the ABCF is to provide resources and financial assistance to aid in detection, treatment, and survival of breast cancer for uninsured individuals. The reason I chose this NGO to talk about is that their mission statement says they help anyone regardless of age or gender. I thought this was very cool because there are such disparities in healthcare in current day due to race, age, class, sex, and gender. Thank you so much for listening to my digital narrative, and here are my sources that I used throughout my project, followed by the annotations.